The scapula beneath the clavicle is what? We're talking about the artery.
The axillary.
The axillary. Axillary is another name for your armpit. That's kind of the region we're in right now, right in your armpit. This is going to be axillary. Now, running down the axillary, we're going to get a few branches. Now, the branches that are called both the posterior humeral circumflex and anterior humeral circumflex. Now, what does that mean? Just circumflex, think about like circumnavigating. Circumnavigating means to kind of wrap around or go around, and that's what's happening. And when we say humeral, it's talking about wrapping around the humerus. And when we're talking about anterior and posterior, it's what direction is it going? So, usually, these models don't show well, but you'll see an artery branching off and going through this space created between the teres major and minor. And it's going to dive through and emerge on the other side as a posterior humeral circumflex. And even if they just take it on this side, you should say posterior humeral circumflex because it's wrapping around the humerus, it's on the posterior side. Does that make sense so far?
Mm-hmm.
Now if there's a posterior, there's got to be an anterior, and that anterior is going to branch off, run lateral, and you kind of see it poking out right there by the short head of the biceps femoris, biceps brachii. Did you get okay?
Mm-hmm.
So this is the axillary artery giving off two branches, and the two branches are?
The posterior and the
Now look
anterior.
at your sheet. Posterior and anterior what? Yes, so that'll get you half credit. It's wrapping around what? So it's got to have the
Humerus.
name. Humeral. Yep. So posterior and anterior humeral circumflex.
And you said the anterior came out by the short head of the bicep?
So do you guys add? Yeah, so here's your biceps brachii. Now understand that this is the short head because it's going to stop right at the coracoid process. And this is the long head because although it looks like it stops, it'll actually continue on and wrap into the rotator cuff. So don't be deceived by the length. Understand that the one that looks like it stops short right up here, closer to the body's core, is going to be the biceps brachii short head. And right between it is going to emerge the anterior humeral circumflex, which is a branch of what artery?
Axillary.
Exactly, axillary artery. And so as we run down, I'm just going to touch base again. What was this muscle?
Teres major.
Teres major. So teres major is more inferior, and teres minor is more superior. Okay, so far? Now, once it crosses the teres major, it will immediately become brachial. Okay? Now, once it becomes brachial, there's going to be a split. Now, don't worry about this guy right here. It'll only confuse us for our purposes. So don't sweat this one. Looks like it's going kind of to the back. So after it crosses teres major, the axillary artery will be brachial, 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 and we're going to get a split right around the cubital fossa, which is kind of the pocket right on the opposite side of where your elbow is. And that's going to split into your radial and ulnar artery, supplying, respectively, the radial and ulnar sides.
Wait, the brachial starts where?
The brachial starts right after the teres major ends. So I'm going to follow the axillary. So it's going to be axillary, 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 axillary. Teres major, brachial. Brachial, 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 brachial. Brachial is going to continue all the way down through your elbow. And then you can't see it so well, but it's going to split and go for a few important branches. One major branch going to the radial side, one to the ulnar side. And you might ask yourself, what's going on with these little guys right in there?
What is going on with the little guys in
So they're small vessels, and while they do each have their individual names, we're going to refer to them collectively as the common interosseous artery. Now, let me back up and tell you guys what interosseous means and what it is. When you hear like osseo or osseo, think bone. So inter, between bone. Interosseous, between bone. And so when you see two bones, there's going to be a region of connective tissue running between the two, called the interosseous membrane. Now that's going to have an artery that will kind of dive through and supply region of connective tissue as well as some surrounding muscles. So when we look at our extended hand and we see this kind of pocket, these are all going to be collectively referred to as the common interosseous artery. Now check out all right?
Yes.
Okay, cool. Now, on your list, you got superficial and deep palmar arch. So, an arch, as you guys know, simple structure. Palmar, talking about your palm. They didn't really think too hard when they made up these names. Now, just discerning which one is superficial, which one's deep, and which one is connected to which vessel, whether it be radial or ulnar, a way to remember. Understand that, did I tell you guys about breaking your scaphoid?
No.
No. Okay, so where's the scaphoid in your hand? Yeah, so yep, exactly. So you have scaphoid on the base of the radial side and the lunate on the base of the ulnar side. Now why is this important? Because oftentimes when someone falls and tries to catch themselves, they'll end up hitting that scaphoid, and because it's a small bone, it's likely to shatter. Now, what's going to happen if it shatters? You don't just break a bone like if you break your humerus, like you just get a cast and say it's okay. If you break your scaphoid, you're likely to rupture a nearby vessel. Now, what vessel are you likely to rupture? You're likely to rupture the radial artery. Because what's happening with the radial artery is that as it courses down your arm, it's going to dive into a region that we're going to call the anatomical snuff box. Can you guys kind of cock your thumb back like so? You guys get those two kind of